出生你会比较正常，就是自然一点。
I think that's a great idea. We should do that. High five.
Oh, I'm so sorry. Are you okay?
Oh, I just thought you were going to hit me.
News reports showed how child neglect cases tripled over the last 5 years, jumping to 4,126 total cases in 2024, with a hefty 31,247 cases of child maltreatment racked up over the last 5 years.
So in this video, we'll talk about child maltreatment, some common intervention methods, some referrals in Malaysia, as well as some myths regarding child maltreatment.
In 2001, Malaysia implemented Child Act 2001, a legal action served to protect, care and rehabilitate children, maintaining children's rights in the legal system. According to Chapter 3, Section 31 of Child Act 2001, an individual who does or allows the following: abusing, neglecting, abandoning, exposing children to both physical and emotional injuries, or sexually abusing children is convicted of child maltreatment. This offence is punished up to 20,000 ringgit of fine, or up to 10 years of imprisonment, or both. It also mentions parents or legal guardians are legally liable against any form of neglect of their respective children. Based on legal implementation, child maltreatment can be defined as a child who is exposed to or at the risk of physical, emotional, or sexual abuse, neglected and denied of basic needs, and being used for unethical acts such as begging. Child maltreatment can be categorized into 4 major forms. Physical abuse, intentional act of using physical force towards children, such as kicking, hitting, strangling, burning, leaving the child with physical wounds. Emotional abuse, acts that can harm a child's mental and social development, such as threatening, discriminating, blaming, non-physical acts that usually come in verbal forms of emotional rejectment or hostile treatment. Neglect, failure of parental figure or legal guardian to provide basic necessities to the child, including nutrition, shelter, and education. Sexual abuse, non-consensual acts and attempts of sexual activity involving a child, including touching sexually, intercourse, viewing of private parts, and nudity exposure towards a child. Note that in Malaysia, girls who are under the age of 16 cannot properly consent to sexual intercourse. Besides that, sexual abuses of children may sometimes come from those whom children trust, such as close relatives or even family friends. It is also important to recognize the symptoms of different types of child maltreatment. In physical abuse cases, children might be found with bruises in head, face, and neck caused by abnormal parenting practices or burnt injuries from cigarette burns. In sexual abuse cases, unexplained injuries in the insides of children's mouth might be signs of forced oral sex. Bite marks near private areas of children can also be an indicator to sexual abuse. Paying close attention to interaction between the children and their parent can also help detect signs of emotional abuse, neglect, and other forms of child maltreatment. All these forms of child maltreatment can leave the victims with potential severe or even lifelong negative impacts. They might display developmental impacts in forms such as negative emotional impact, experiencing anxiety, post-traumatic stress disorders, mood disorders, and difficulty maintaining emotions, negative self-concept, developing low body image disorders, and low self-esteem. Negative cognitive impact, leading to poor social skills and lacking in academic performance. Behavioral issues, such as attention-seeking behaviors and substance abuse. Negative physiological impact, causing victims to have delayed or stunted growth. Besides the negative impact towards victims, it is also important to investigate the potential risk factors that can cause increased likelihood of child maltreatments to occur. Research showed socioeconomic status of parents, influenced by inflation rate and employment status, greatly increases stress in managing resources, parenting their child, and maintaining social image. Living with domestic abuse is also a big risk factor. Children who witness domestic abuse, which can involve acts of violence, drug use, alcohol consumption, can cause the child to develop aggressive behaviors that also poses a risk factor to maltreatment, causing the cycle of a dysfunctional family. Furthermore, parents or caregivers suffering from mental or physical health problems might not be able to fulfill their child's basic needs, leading to educational and emotional neglect. Moreover, low neighborhood quality, symbolized by presence of criminal activities, can increase psychological aggression among the community and deny children peer bonding opportunity. All these factors increase the potential violence exposed to the victims, even when it's not directed at them. which causes the child to be denied of basic living necessities, including but not limited to proper social and physical space for growth. This is why it is important for us to be educated regarding the common intervention methods of child maltreatment.
I will discuss common intervention methods for child maltreatment. Research shows that some methods have been proven to be effective. Not only can they reduce maltreatment, but also improve family affection and child well-being. Let me grab 5 important methods: cognitive behavioral therapy, home visitation programs, parent training, family-based or multi-systemic therapy, and combined interventions. First, cognitive behavioral therapy, also known as CBT. This is a mental with structured, time-limited therapy. It helps children and their caregivers identify, challenge, and replace unhealthy ways of thinking with healthy ways. The key idea is that all thoughts influence our feelings and behaviors. One well-known form is trauma-focused CBT, often called the gold standard for children who have been abused or ignored, because it not only reduces past traumatic stress, but also helps children adjust their emotions and reduce their anxiety and depression levels. Next is home visitation programs. In this approach, trained professionals such as nurses and social workers visit families at home, especially those at high risk, like parents with infants or children. The aim is to teach positive parenting skills, share knowledge about child development, and provide social support. Home visitors can find warning signs before problems happen. A famous example is the nurse-family relationship. Research has shown that it reduces child abuse and improves mental health, making it a strong preventive strategy. The third method is parent training, also known as behavioral parent training or parent management training. Through this way, caregivers can learn practical strategies such as consistent discipline, positive reinforcement, and problem-solving skills. It is based on social learning theory, meaning that children can learn by observing and experiencing it. This shows that this problem reduces extra behaviors in children, such as aggressive or defiant behavior. At the same time, parents will become more confident and feel more powerful in solving daily problems. The fourth method is family-based or multi-systemic therapy. This is a method through a community and family-centered approach, mainly for adolescents who are at risk of maltreatment or delinquency. The strength of MST is that it doesn't just focus on child. It looks at many systems, including the family, peers, school, and even the wider community. The therapy aims to improve family communication, increase parental training, and strengthen problem-solving skills. Research has shown that it can reduce child out-of-home placement and lower delinquent behaviors in young people. Finally, there are combined or integrated interventions. These programs integrate different methods together. For example, a program may combine home visitation with parent training, or paid CBT with achievement-based therapy. The advantage is that intervention can address not only cognitive and behavioral problems, but also environmental and other problems. Because of this method, the outcomes are more sustainable in the long run.
Now I'll talk about how Malaysia manage referral pathways, the role of different institutions, and what each of us can do when we encounter cases of child maltreatment. In Malaysia, child protection is supported through community-based initiatives and institutional services.
This includes the Social Welfare Department, healthcare providers, and non-governmental organizations. These institutions form the backbone of our referral system, making sure that children at risk are directed to the right care and protection. One important group in this referral process are childcare providers and educators. They are usually the first to notice when a child is neglected or maltreated. However, research has shown that these educators and preschool care providers face high psychosocial strain in their work. This tells us that we need clear referral guidelines and proper training so they can protect children effectively without being overwhelmed themselves. In short, institutional services not only protect children, but they also support the teachers, caregivers, and healthcare staff who act as the gatekeepers in detecting and reporting child maltreatment. Alongside this institution, Malaysia also invests in preventive programs. One great example is the Naungan Kasih Parenting Program. This program focuses on the positive parenting and reducing the use of harsh discipline. Studies show that parents who joined Naungan Kasih improved their ability to handle stress and conflict. More importantly, they became more willing to use formal referral channels when they faced difficulties. What makes this program special is that it builds trust between families and service providers. It encourages parents to connect with welfare officers, community counselors, and healthcare professionals. In this way, programs like Naungan Kasih strengthen the safety net for children and prevent violence before it even happens. Now, let's look at the most practical question. What should we do when we find child maltreatment? Children should immediately seek help from a trusted adult like a teacher, counselor, or relative. In Malaysia, they can also call the Talian Kasih 15999 helpline for immediate assistance. Parents have the duty to report suspected cases to welfare officers, police, or healthcare professionals. They must also provide emotional support and safety to their children during this difficult time. Caregivers and teachers play an important role too. They should observe and document signs of abuse and then follow referral protocols by contacting school counselors, child protection services, or hospitals. It is important that they do not confront the abuser directly, but instead focus on the child's immediate safety. Finally, community members and others must remember, never ignore or stay silent. Every case should be reported. Community members can also guide families to proper services such as welfare departments, NGOs, or healthcare providers, and promote awareness programs to reduce the stigma and encourage reporting. To conclude, Malaysia's referral system for child maltreatment combines institutional services, preventive programs, and community responsibility. Educators and healthcare staff serve as gatekeepers. Parenting programs build trust, and the law provides protection. But ultimately, every one of us, parents, teachers, caregivers, and community members, plays a role in ensuring that children grow up safe, loved, and free from harm.